Well, I want to officially welcome everyone to our webinar here today, where we will be discussing health and community after quarantine, hosted by Texas Oncology and the Texas Oncology Foundation. You know, as I mentioned, with people were signing on, whether you are watching here on Zoom or you're watching from Facebook, we're happy that you are here. We are doing this conversation as a follow-up to our May conversation. We were continuing this discussion because we're all still here virtual. Things have started to change, things have started to open up, but we're in this new normal and we're all trying to really navigate it. And so this is a great discussion, you know, for us to talk about what now, what is life after quarantine? What does it look like in the wake of this pandemic? So a few housekeeping rules. We can't see you, unfortunately. You can see us, you can hear us, but we cannot see you. But we want to hear from you. So the chat is the tool that you will use. We want to hear from you if you have questions, if you have thoughts, if something resonates with you and you want to give a thumbs up, or you want to say, yeah, totally agree, or I need a little bit more info about that, the chat is going to be your just favorite best friend. If you're having any technical difficulties, Kelly from the Texas Oncology Foundation is in the chat, and she is going to be your go-to to help you navigate whatever technical issues that you're having. Hi, Kelly. We accepted questions from our panelists when you registered, and so we have some of those questions, and we'll try to get to as many as possible. If you didn't have a question when you registered and something resonated from one of our panelists and you want to share that now, drop it in the chat. I'm definitely also going to be in there getting those questions and sharing them with our panelists. So a little about me, if I haven't met you, my name is Tamika Felder. I am a cervical cancer survivor, and I am thrilled to be able to say that. I use my survivorship as a way to make my experience with cancer count. I want to be an example how to live your life after cancer. If you are still dealing with a cancer diagnosis, I want you to still live. I want you to be that person that you were, not necessarily before cancer, but before cancer changed everything about you. I want you to know that cancer doesn't have to stop you from everything in your life. Does it pump the brakes on things? Yes, absolutely. And so I joined Texas Oncology, the Texas Oncology Foundation, working with their Survive and Thrive Summits. If you've been to them, you know that is one of my favorite events to attend, because for me, it's the epitome of what we should do with that cancer experience. It happened to us. Now, let's survive it and let's thrive through this whole process. And I hope one day and I know one day we'll be back together again doing those awesome events. So about the foundation, the Texas Oncology Foundation is dedicated to providing support to cancer patients in the communities where you live, work, and receive treatment. I think that's the best thing about what Texas Oncology does. It's right there for you. It's at your fingertips, and they make it so much about community, which is important when you're going through a cancer diagnosis. Also, I mentioned the Survive and Thrive Symposiums, just really a stellar event that is put on by the foundation to provide educational events, resources, and to help build community and support. Whether you are a transplant and you don't have your people or your family near you, we are a community. We have not only these webinars, they're in-person events, they're tools, they're resources. If you have not gotten familiar with the Texas Oncology Foundation's website, I implore you to do that after this webinar. Another thing to note, the foundation depends on wonderful donors like many of you. And the great thing about it, all funds raised stay in the Texas Oncology communities where they are raised to provide financial and transportation assistance to those receiving treatment. And we know how incredibly important that is. I am proud to introduce our wonderful panel that is joining us today. And we have Dr. Wolfong, Dr. Pat, and the wonderful Stephanie Broussard here. And so we're going to take a moment and let them introduce themselves, and we're going to start with Dr. Wolfong.
Thank you. Hi, I'm Dr. Wolfong. I am a medical oncologist based in the Dallas area. I currently serve as the Vice President of Value-Based Care and Quality Programs for Texas Oncology. And what does that mean? It means I work closely with the operations team to help improve the care that we provide in our sites to make sure that your treatment is efficient and timely, that we help answer your needs and meet your needs, keep you out of the hospital, keep you safe, and get you through your cancer journey back to the rest of your life. So that's what I focus on with the wonderful team that I get to work with.
Wonderful.
I'm Dr. Deborah Pat. I work with Leyland as the Vice President of Texas Oncology. I oversee policy and some of our strategic initiatives. So I've been integrally related with the telemedicine program, and also work with our policymakers quite a bit on trying to make sure healthcare policy mirrors what cancer care needs. And I practice in Austin as a breast cancer specialist.
Thank you.
Hello, I'm Stephanie Broadnex Broussard. I am the Director of Palliative Care and Social Work here at Texas Oncology. And I have the honor of supporting the work that Dr. Pat and Dr. Wolfong lead to help make sure that our patients receive adequate psychosocial support along with palliative care services as we continue to grow in that area. So I'm excited to be here. Thank you for having me.
Thank you for joining us. One of the things that I want to ask before we get started, I want to start with a question that's not necessarily cancer related, but definitely quarantine related. So what is something that you have learned about yourself since this pandemic? What's one thing, you know, good or bad or indifferent, that you've learned about yourself since this pandemic? Anybody?
Ladies first.
I will say I have learned in my bustling household that I need quiet space sometimes. In my household, I have 3 children and a spouse and 3 dogs, and it's bustling, and chickens. It's bustling all the time. And so I've learned in our 6 months of all being under the same roof that quiet time is important to preserve. And more broadly, it's important to manage your stress and stressors intentionally with a set of tools that we can think of thoughtfully.
Wonderful.
That's really good. Dr. Pat's was awesome. Sounded a little social worky-ish, but that was great. I think the thing that I've learned about myself in this pandemic is that although I'm a foodie and I think I'm really great in the kitchen, I'm not as good as I thought. I think my children are doing a great job of making sure that I'm keenly aware that I don't have a diverse set of recipes to reach out to. So that is something I'm really trying to be intentional about because apparently they're tired of eating the same thing. And so that's something I've learned about myself during the pandemic.
So I'm a very social person, and I miss greatly the social aspects of life. You know, it's hard to connect with people with a mask on. It's hard to connect with Zoom. So I'm learning how do we can keep my social connections going with my friends, other family, and other things while remaining safe. So I knew I was social. I've learned I'm much more social than I thought I was. That's my source of strength. And so how do I incorporate that into my life to remain continue to have that strength provided to me? So Tamika, you have to answer the question too.
Oh, I'm going to. One of the things that I have really missed is going to the movies, right? And I've realized that I can run out of things to watch. But I've also spent my time I perfected making my own popcorn. I really, really love movie theater popcorn. And I've learned to do it kind of a healthy way, but really, really good. It's not as exciting as all of you, but that's my thing. I'm like, I really love these popcorns that I'm making, and they're like gourmet and delicious. But yes, we have so many questions in this chat. So I'm so excited to really kick this off. Thank you all for helping us with get started with the icebreaker. So I want to really, talk to you, Dr. Wilfong. And if you could start us off with giving an overview of where we stand right now. In the media, there's so much news, social media also, there's constant things coming our way, and we don't necessarily know what's true, what's false, what matters most to us with our unique situations. So if you can tell us kind of where we are, what's the overview, and now that, excuse me, we're moving into the winter months, what will it look like? What should we expect, and how can we best take care of ourselves?
Great questions. So I'll try to pack that all down into a concise answer. So we did see a spike in cases through the summer in Texas. June, July were crazy with cases, lots of community spread. Luckily, our caseloads have been going down over the past month, which is fantastic. The mask mandates have helped, clearly to help prevent the spread of the virus. Now with school starting back up, we are starting to see a slight uptick in cases. Whether that's going to translate into a significant uptake or not is still to be seen. Everyone's worried about a second wave. Europe's going through their second wave right now, where they're starting to see an uptick in cases and how they're managing that. So I am worried that we're going to have a second wave in the fall, although it's too early to say that just yet. I would say masking, continue definitely doing that. That's by far our best measure of protection. And staying safe, socially distancing, staying out of public as much as possible, especially if you're undergoing cancer therapy. And we'll talk a little bit more about those details here in a little bit. I would say it is challenging to separate the wheat from the chaff when it comes to the communications that are out there. There's a lot of, unfortunately, we're in a political season right now, and there's a lot of political taint to the messaging that's out there now, especially on social media. You will see that a lot. I would say Texas has done a very good job with their communications. The Department of State Health Services, if you Google Texas DSHS or Department of State Health Services, they do have a very up-to-date, accurate website as far as what's going on in Texas right now. So that would be a good source of truth for you, or your local county health department would be a good source of truth for you if you needed to understand better what was actually going on.
Great. Anything else that you would want to add, Dr. Pat?
I think that in addition to the resources that Leyland spoke about, for our cancer patients specifically, they've done a good job of putting links to all of those resources on the website, which is incredible. And with questions about what's to come, I'll say a lot of our concerns about fall are temperature related, but they're also how do we act with the flu season coming. And what I would say to this group is it's more important than ever to get your flu vaccine this year, because say, for example, you are a cancer patient and you're on active treatment. If you get influenza and symptoms of influenza and you have fever, there's no way for us to really know that that's not a coronavirus infection, and it will likely delay treatment and office visits. And so, it's more important than ever for patients that are survivors of cancer, that have active cancer, family members, really everyone, to get the flu vaccine. And I know some people are reluctant because they don't take the flu vaccine. I hear that a lot. This is your year.
Yep.
I agree. This is the year to get it. I actually have mine scheduled for 2 weeks from now. One of the things that we've asked, and I don't know if anyone has a mask handy, right? But there are people who want to know how to wear a mask properly. There's also a question, and I think this is, are clear masks safe and secure? So if someone in the group on the panel could demonstrate the correct way of wearing a mask, and someone answer, are clear masks safe and secure to use?
So I can take that. So I do have the handy little mask here. So when you wear a mask, you definitely want to make sure it stays over the nose and the mouth. It's an aerosol spread virus. And there are two benefits to the mask. One is it protects you from other things coming into your face. But I think even more importantly, and this is the reason why mask mandates are so important, is it protects for you from going out. And so that dual protection of you going out and then stuff coming in keeps us safe and markedly lowers the risk of transmission of the virus. And so what you want to make sure is that the mask covers your nose, covers your mouth, come around the ears or around the back of the head, but it needs to stay like this. And most of the masks, the good ones, have little strips here that you can snug to your nose to keep things from coming in or out there. And you want to make sure it comes down over your chin. So it's important that it fits properly and stay snug to your face. I see people with really loose masks that kind of hang like this. That's not as safe. This is definitely not safe. It's like wearing your underwear down around your knees. Don't do it. This clearly is not safe. So wearing a mask, over your nose and your mouth is super important. People talk a lot about the different kinds of masks. Cloth masks are good. Surgical masks are even a little bit better. And then the N95 mask, which is the medical grade mask that really fits well, is the best. Now, N95s are in markedly short supply. And so and we are in Texas reserving those for our frontline healthcare workers who are taking care of patients with COVID. Because they need the best protection if they're actually actively with someone with COVID. Surgical masks are fine if you can find them. Again, supplies tend to be limited in public just because they are reserved for healthcare workers. And then a good cloth mask is perfectly fine. Vented masks are something we do not recommend. Some people use these vented masks so they can breathe better. The problem with that is everything that you breathe comes out. And so you're not protecting people with a vented mask. Whatever you're breathing out is coming out into public. And so we do not recommend vented masks for people. Clear masks are fine as long as they do those things, as long as they keep everything in your face. I know there are some, especially those with hearing difficulties where they do lip reading or things, are using clear masks so that they can actually be able to read lips and communicate appropriately. All right, did I miss anything, Deborah or Stephanie?
I thought that was great. And I think to your point, there's variability in the quality of masks, how thick they are, how many particles they filter. But the most important thing probably is that you're consistent in wearing them when you are outside of your household and around other people. And as Leyland mentioned, from the chin to the nose, and make sure that it has a snug fit. That's going to help protect you. It's not perfect, but as we recognize that most of the transmission of coronavirus is because of particles that are in the air, and being in close proximity to others that have airborne transmission, that it makes it a little bit safer for you and certainly safer for others if you were to be infected.
Yep. And there's a couple of questions came in about masks. KN95s, there was an article today in the USA Today about KN95s. Those are the international made masks that came over. There are differences in the quality of those masks. I would say we use some of those in our clinics, but they have been vetted by multiple different people to be safe for our physicians and our staff to wear in our clinics. It is true that the KN95s that you may find in the grocery store, for example, may not be as of sufficient quality. That being said, again, Deborah said it well, main thing is to have something over your nose and mouth to prevent that spread. Breathing, there's a question about breathing. Breathing does spread some aerosols, some. It's not as much as sneezing or coughing because then you're taking a lot of air and forcefully expelling it. But still breathing is a mode of transmission. And again, that's one of the reasons why you should be masked when you're out in public. And then we recommend everyone is masked because then it stops any aerosols from coming from someone out, and it also stops them coming into you.
People are also asking about reusing masks, and I would say that you certainly can reuse masks. I think that, you know, what many of us have done is alternated masks on a daily basis. If you need for the mask to be sterile, you can even have mechanisms to sterilize them. But truthfully, even just washing or setting a mask aside for a couple of days is probably sufficient. But I would rotate, and certainly there's no need to throw masks away after one use.
Correct.
Great. So Dr. Pat, we're going to continue with you and tell us, you know, what can we expect with appointments? You know, will telemedicine continue? Should, you know, people be nervous about appointments? What's the best way for them to get over the anxiety of an upcoming appointment?
It's a great question, Tamika. So I'll say that while we are enjoying tremendous benefits of COVID-19 decreasing in our community across the state, and while it's variable in every community, by and large, the state is doing well. Our clinics, because we see the most vulnerable Texans, have to be continue to be safe, have to continue to implement screening guidelines, continue to implement safety protocols. What that means is for Texas Oncology, many of our operational processes don't change because we have to be sort of the gold standard of safety across the state, given our vulnerable patient population. So if you imagine that some healthcare organizations are doing things like letting in visitors or other things, know that we are going to be the very last to adopt those changes. And the reason for that is because we have to be safe. We see the most vulnerable Texans who were affected by cancer. So you'll see many things remain the same. We're presently not allowing visitors in our offices. We are implementing screening protocols. We maintain social distancing. Our clinics, both in the waiting room and in the infusion center, have a decreased overall capacity to try to facilitate social distancing. Because of all those important changes that are continuing, telemedicine will continue. And it's really important. It's been critical for us in seeing established patients. I personally have diagnosed coronavirus in patients and given them counsel and given them guidance and kept them out of the hospital and kept them out of my clinic, away from staff and away from other patients. That's been critical. I've used telemedicine to manage established patients who need modifications of their medication or guidance around abnormalities or just routine follow-up. And I've also used it to see and evaluate new patients, which has been critical because new patients need to be seen and evaluated quickly. And by using telemedicine, frequently we can do that right away. And so telemedicine, I think, is here to stay forever, but it's clearly here in a robust capacity through the duration of the pandemic. So we will continue to do quite a bit of telemedicine. People can continue to interact with their teams in that way. In fact, we're trying to think about how we grow the system to further accommodate folks. And I would say that it's been critical for Texas Oncology as we think about how to keep you safe, how to keep our cancer care patients safe. But it's also critical in general because patients need medical care. Coronavirus has brought about a lot of anxiety that has facilitated medical distancing. That has negative consequences. We know cancer screenings are down 80%. Cancer visits across the country are down about 40%. New cancer diagnoses are down about 40% across the country. The natural consequence of that is that people are going to be diagnosed with later stage cancers, and we can anticipate that cancer mortality will go up. In fact, there was a UK article that suggested cancer mortality would go up about 15% in the next decade for lung cancer because of delays in diagnosis. So telemedicine is a really important way that despite anxiety, people can stop medical distancing and get the care they need. So that's really critical.
That option, yeah. I'm glad we had that.
And I'll say that there was a question that folks had about risk because obviously people are fearful. There's a lot of well-published statistics out there suggesting that cancer patients have higher mortality when exposed to coronavirus. And there was a question about survivors and if they have what their mortality is like, or patients on tamoxifen. And what I would suggest is those are great individual discussions with your physician, but in general, patients with advanced cancer do have a higher mortality related to coronavirus. And patients that we believe to be cancer-free, who are survivors in routine follow-up, generally are around that of the average public. And so, but those patients continue to be at risk. So it's not that they're not at risk, they're just not as high of a risk as patients with advanced cancer. Around the issue of tamoxifen too, I would treat patients on tamoxifen as if they are the average risk of a cancer survivor. And not at the same kind of risk, because it's a 6-fold increased risk we see with patients with advanced cancer. But the whole patient population needs to be safe, as the whole country, the whole world needs to be safer and practice good behaviors to try to decrease the risk of getting the virus.
Yes. We also had a question that came in on Facebook. There are 2 different strengths of flu vaccine. Which is the most appropriate for cancer survivors?
Leland, do you want to take that?
Yes, give you that. So yeah, there's the quadrivalent vaccine, the high vaccine, and the regular vaccine. If you're 65 and older, it's clear that the quadrivalent vaccine is more beneficial or more efficacious, I should say, in preventing the flu. So that's one I would recommend. That's the one we typically give in our clinics as well. So I would say cancer patients on therapy should get the higher vaccine. If you're not on therapy and in survivorship and not on active therapy, I think either vaccine is fine. The big point is getting a vaccine because, as Deborah mentioned earlier, you do not want to have the flu during COVID because we're just not sure what's going to happen if the flu season is bad. So make sure you get your vaccine. They are safe and efficacious.
Thank you. So I want to ask Stephanie, caregivers, how can, can loved ones go to an appointment? How can they be supportive? How do they best fit into this equation of this new normal of quarantine-ish and cancer?
Yeah, that's a great question. I think the support system is such a critical part of the cancer journey. And so it's really important that we not, because we are having measures that reduce access to our visitors, but that doesn't mean we have to reduce caregiver engagement in the process. And so some helpful things to think about is as your loved one is preparing for their appointment, maybe sit down and jot down some questions so that you guys have questions that will be answered, and they can take with them to the appointment and jot down the responses as well from their provider. Something else to think about is you can be a great caregiver assistant with making sure they stay organized for their appointments, making sure that they're aware of their labs and keep on track of those things. And so we keep a great line of communication at Texas Oncology. We want you to be involved as a primary caregiver. So if there are some questions or clarification that you need regarding treatment or appointment, don't feel like you can't reach out or ask for clarification. As long as you're listed on your loved one's HIPAA contact information, we have no problem making sure those lines of communication stay open, but also making sure that if they're in an appointment, most smartphones do have apps that allow you to record, and our providers don't mind you doing that. So to make sure that there's communication, because those second pair of ears are really important. And so we also, with our telemedicine, with our portals, we're looking at ways to make sure that we have additional options where a third party can join into that conversation as well, so that maybe if we're having a telehealth visit, that an additional party would be able to connect in that visit as well. So we want to make sure that you stay connected and make sure that if there are questions that you have that you feel like are unaddressed or concerns, outside of writing them, also reach out to your care team to have those questions answered.
Yeah, so let me add to that too, that as I frequently encounter this issue, as I have been diagnosing a lot of new patients with cancer during coronavirus, and they don't have their loved ones with them, there are a couple of things that I offer. Either if I'm in the room with the patient and they're physically present, we can use their phone to FaceTime their loved one or set up a VC connection, which is our telemedicine platform. If I'm doing telemedicine with a patient and they have their caregiver with them, obviously their caregiver can hear everything, which makes telemedicine in some ways a preferential way to communicate with patients and caregivers, especially when you're providing a lot of content and education. I offer for patients to record the visit. So I think that's another acceptable way. And if you are not physically located with your caregiver, and you're going to have a telemedicine visit, there are ways also to add additional individuals onto those telemedicine visits. So I think there are many ways, but you do need to think about it before a visit, and think about how you will facilitate caregiver engagement, because caregiver engagement is better for everyone. It's better for the caregivers because they care about you. It's better for the patient because they're able to help reinforce your treatment strategy and support you appropriately. It's better for your doctor because we want your team engaged, informed, and ready to help you. So it's really in everyone's best interest to think proactively about how to engage caregivers and to discuss that with your doctor. But I think there's many possible ways to do that successfully.
Wonderful. Stephanie, another question that we had that was really popular, do people need to continue to self-isolate? How do they know when it's considered to be safe to go around friends and family again, or even support groups? That is a crucial part of, thriving during a cancer diagnosis. And we really do want people to join us virtually. It's important to do this too, but we know that people crave that interaction, that people want to come together. What advice do you have for that?
So I'm going to also tag Dr. Wilfongen or Dr. Pat after I give my answer as far as safety measures and when it's safe. But I think from a social standpoint, I think you're exactly right, Tamika. We can't ignore our need to come together as a community, but that doesn't mean it has to look the way it always has. And so one of the things that we're doing at Texas Oncology is creating virtual support groups and making sure that they are ways to engage and create a sense of community for our patients where that may be lacking. But also with making sure that there are opportunities to engage your family. I think we talked about this on our very first COVID call that we did with the Facebook community, is making sure that you guys are using the tools that are available to connect with your family and your friends, and whether it's your social circle or your spiritual circle, making sure you stay connected and use the resources that are available. So whether it's Zoom or FaceTime or Google Duo, a lot are Facebook Live. There are a lot of communities now that are available to make sure that we don't have to lose a connection. It just may look different. Also, a lot of the agencies and organizations that we partner with have virtual platforms as well and social support. Our foundation offers great webinars and opportunities to connect as a community. So even if it's your family game night does not have to happen. You guys just have to be creative. There are a lot of additional opportunities for virtual games to plug in. Even I saw someone play Uno, which is my favorite game, but play Uno via Zoom. So there are, yes. So there are a lot of options. We just have to be open to seeing things differently. And it may not feel good. We may not physically feel that hug and feel that physical presence, but that doesn't mean that emotional connection has to go lacking as well.
I agree.
So let me add to that and say that we are so fortunate to have someone like Stephanie leading our social work and palliative care programs.
I paid her to say that.
Because she really thinks outside of the box, and recognizing the needs of our patients, developed virtual support groups, which has been so value add for us. But I think we all need to think outside of the box, because how we touch others as it supports our cancer journey is so critical in life in general. I'll say personally, I have a family dinner with my family every week. I have elderly parents and an elderly aunt that live in town. They're all over 80. And I've thought, how do we aggregate in a safe way? And so instead of, 15 of us huddling around a table and all sharing the same food, I've created a scenario in my backyard where 10 of us can sit at 10 feet distance, and I plate the food ahead of time, and we still see each other. And that's not that that's for everyone, but my point is just that we need to think creatively about how to continue to engage with people, because it's really important. Otherwise, depression and anxiety can really manifest and get worse. And so it's really important that we engage with others. And so think creatively how to do that. And if you can't figure that out yourself, I'm sure your loved ones and your caregivers can help you think about that. Remember, none of us face this journey alone. You have a lot of people here to help you here at Texas Oncology, and your loved ones that surround you.
And I think we had a question about engaging in social settings for cancer survivors or support groups. And so at Texas Oncology, we are not hosting internally any of our face-to-face groups at this time. But as Dr. Pat said, I think there is some room for us to participate in social distancing opportunities when it's safe. So make sure that that's something that if you're considering participating, that you've talked to your provider about your desire to do so, and if it's safe for you. And so that's something to consider. But then also one of the things I think that came up was, as caregivers, when you're in the distance, how do you support your loved one by making sure that they stay connected and you stay connected? They still feel like they have a support system. And so one of the things I want to say is that I want to encourage caregivers to make sure that you offer ideas for support. A lot of times our loved one, they're worried about their treatments, they're worried about the day-to-day. And so sometimes when you ask, do you need anything? They don't know the answer. And so sometimes it's helpful to make some suggestions to say, you know what, hey, I was going to order me something on Uber Eats. Can I have you something delivered? Or I know I was going to do my cart from Amazon Fresh or Whole Foods or whoever. Can I go ahead and get you a cart ordered? Or is there something that that you're thinking about for yourself while in the pandemic? They need those things as well. So consider them as well when you're doing that. And it's really helpful. And also stay connected via telephone and contact any way you can, whether it's Caring Bridge or those different apps. Don't neglect our original methods of communication. Call people, text them, stay connected, because now we need it more than ever because there is the reality of isolation. And so that's kind of my 2 cents. I hope I answered the question.
So great. Thank you so much. We are already 41 minutes into this. So I am going to try to get us through so many of these last minute questions. The chat is on fire. It has been going nonstop. So Dr. Wilfong, let's talk about risk because of a cancer diagnosis. You know, how long would someone be considered at risk, whether they're a long-time cancer survivor like myself, who's at 19 years, or someone who may be at 2 years, 5 years? What is the risk for a cancer patient?
Great question. It's complicated. The best way to get an answer for you is to talk to your doctor and your care team because there's so many variances in the type of cancer, the treatment that you had, the long-term effects of that make it difficult to give a generic answer. So at the end of the day, the best answer for you is to talk to your doctor and your care team who know you and your cancer and your specifics better than anybody else. So couching that.
Great answer.
Right. If you're on active therapy, meaning that you're undergoing treatment for your cancer, in general, your risk is higher than if you're not on active therapy. In general, if you have a cancer that suppresses your immune system, or if your doctor has said your cancer makes you at risk for infections, you're going to be more at risk. In general, if you have other medical conditions like diabetes or heart disease, you're going to be at higher risk. The challenge is we still don't know a lot about COVID. We still don't understand why some people get really sick and some people don't. You see news reports of a 95-year-old who had COVID, who did well and recovered and is doing great. And then you see reports that came out like this week in Houston, where a 25-year-old healthy OB-GYN resident died of COVID. We don't understand exactly why some people get serious symptoms and some people do not. So I say that just to say to make sure you're taking every precaution you can to stay safe, masking, social distancing, washing your hands, just being safe. And then definitely talk to your care team about your specific situations so that you understand what specifically it is for you, and get your flu shot.
Yes, get your flu shot. Get your flu shot. You really opened it up to this next question that, I know so many people are talking about. Are we any closer to having a vaccine readily available?
So we are. I mean, there are vaccine trials ongoing. They're currently, many of them, in phase 3 trials. That means where they're giving vaccine to some people and not to others to see what happens. Normally, it takes a few years to do vaccine trials because you need to look at safety of the vaccine and whether it actually helps prevent the infection and things like that. But they're speeding up that process using some of the tools we have now to try to get vaccines out more quickly. Again, it's one of these areas where it's hard to tell what is politically motivated in communication versus what's real, whether we're going to have a vaccine this fall or whether it will be early next spring. It's not clear, but there should be a vaccine at some point in the near future, whatever that looks like. I will say what is pretty clear right now is that priority for that vaccine will be healthcare workers and first responders, those who are at most risk of in taking care of patients with active COVID. Those will be first. Vulnerable populations have been said to be second. Now, how they're going to define vulnerable populations is not clear yet, whether that's going to be based on age or medical conditions like cancer or things like that. They haven't said yet. We do know that healthcare responders are first, healthcare workers and first responders will be first, vulnerable populations second, but I can't tell you exactly how that is going to be answered at this point.
Thank you. And also, does Texas Oncology play any role in the development or testing of the vaccine? Do we even know any of that yet?
So we do have multiple staff members or caregivers that have volunteered to be part of vaccine trials. If it's not there, I will make sure it's there. The list of what we know the currently available trials in Texas are, because there are trials in most of the major cities for the vaccines if you want to do that. I would say as a cancer, if you're a patient with cancer, I would not go on the trial, and you're probably excluded from going those trials anyway, just because we don't know the safety of those vaccines in patients who have compromised immune systems at this point. However, we are encouraging, if you're wanting to, staff, family members, things like that, to go be on the vaccine trials if they want.
Dr. Pat, did you want to add anything?
I was just going to say that Leland gave a much more articulate answer, that nobody gave us a crystal ball. And so we don't know what the future will hold. I think it's unlikely that in the next several months that this is all going to go away. I think that the likelihood is, even with rapid evidence to suggest vaccine success and rapid dissemination, that how we see and treat patients, how we live, how we work, will likely be substantially altered, at least for the next year. And so even though I have great hopes for a vaccine and have seen medical progress at a pace that is unprecedented, there are practical realities to risk. And again, like I said at the very beginning, we will always be the last to adopt changes because we see such a vulnerable patient population.
Thank you. We're gonna keep going with these. So we have, do we still need to wear a mask? Even though I think you basically answered that, I just wanna make sure we definitively answer that for the person that asked that question.
Yeah, I think actually wearing a mask is critical, not only to protect yourself, but mostly to protect others. So think of it as sort of something that you're doing on behalf of other people. It also does protect you to some extent. And so that's really important. And then I think more globally, as we think about our world and the economy and how we move through this pandemic, if we're able to operate more normally because we're masking, and the result of that is that we don't have to shut communities down to lower risk, that's really beneficial for global health and well-being. And so, yeah, I think masking is really important and is an easy thing that we can do, not just for ourselves, but for others as an act of kindness and safety and public health and welfare.
I completely agree. Masking is vitally important. I mean, I don't go anywhere without a mask. The only time I don't wear it is when I'm sitting in my office with the door shut, or I am at home with my family. There have been a lot of questions coming in about other things too. Social distancing is important. The safest place for you is not interacting. Now, obviously, as Stephanie mentioned, that's super hard. We do want to see our loved ones and our families. But staying 6 feet apart, if you can, is good. Being outside is much safer than being indoors because of the air circulation. So if you, like, I think Dr. Pat had a great idea. If you're going to see your family doing a dinner outdoors, especially now, hopefully in Texas, our weather will cool off and we can actually be outside. Being outside is much safer because any particles that may be transmitted are whisked away, and rather than being recirculated indoors. So if you're going to see family, being outside is far safer than being indoors. And then And then, you know, the hand washing and things like that. And the other important thing is, I can't emphasize this enough, your family members have to understand if they're feeling ill, not to come around you. You know, I've seen numerous times in our clinics where people were like, well, I just thought it was a cold, or I just thought it was this or that. If you're not feeling well, make sure that people are staying away. And as hard as that is, if you're not feeling well at this point, don't interact with others, especially those people with cancer undergoing therapies.
I couldn't agree. I couldn't agree with Waylon more, and I would just say I would like to put it on a billboard, because I have seen the pandemic affect people in so many different ways. You know, profound anxiety, depression, extreme changes in their lifestyle. But I think that if you do some simple things, you can live pretty normally by masking, by keeping a social distance, because it really is prolonged interaction of aerosolized droplets in close proximity. So by socially distancing, masking, washing your hands, not being around sick contacts, you know, that reduces a tremendous amount of the risk. Now, risk will never be zero, but it reduces a tremendous amount of the risk that allows us to live. And living is really important, because 6 months into this, the extreme of being inside your home and being sedentary is also not healthy. You know, we need people to be exercising, and emotionally and mentally, it's good to be engaging with others. And so really understanding the practical ways that you can reduce an overwhelming amount of your risk helps you embrace healthy behaviors.
You know, I will share that in June, I had a really hard time. And I'm like you, Dr. Wolfung, I'm an extrovert. Hello, survive and thrive. That's my place to be with my people. And it was really hard for me to just be at home. Also, I had to figure out ways to keep moving, stay engaged, which is why I'm like, hey, I know my friend has a Connect 4. I'm going to order a Connect 4. We're going to get on Zoom and we're going to, you know, play Connect 4 against each other. You know, we had to work it out, but eventually we did it. And that was a way to connect. I think that, you know, what our experts have given us today is just so important. And I just really want to reiterate them that it's not just about the keeping COVID away from us, the physical part of it, it's also the mental component of it. And what Dr. Pat said is true, like it's not going away anytime soon. So we're going to have to figure out those ways to start living again. I just love that so much, because with this community, that's what's so important in the first place, learning to live again. And I will say this, we have already quarantined as cancer patient survivors and thrivers. We know how to do it. And so we need to put those practices, back in place in order to keep ourselves safe.
Yeah. And I just wanted to add, I think just highlighting the emotional impact of the pandemic is so important. Making sure that you are aware of your support system and how to engage them if you identify a change in yourself. Because we are home, sometimes the symptoms of depression we may miss them a little bit more, right? Because we're really, some things that are indicators or not feeling as interested in doing things. But right now we don't have things to do. So you may not catch those kind of things, or changes in your appetite. We're closer to our refrigerator, so all of us are eating a little bit more. So just make sure that the signs and symptoms of depression, you're aware of them. And if you do identify some of those, make sure that you feel comfortable talking to your provider about those, but also tapping into your support system to say, hey, here's where I am right now. This is something that I may need a little bit of assistance. I may need to talk to you a little bit more because I'm feeling a little bit closed in, and using the power of your voice to let your support system know what you need.
The power of one's voice is so incredibly important. And I think this is the time to implore people to be vulnerable and speak up for what you need. Say, I need physical interaction. Can you meet me at a park and we stay, at a great distance, but I just see you and know that we're there. Make a Zoom date, do whatever it is that you need to do. I think those things are incredibly important. I also, want right now to give our panelists just to share their final thoughts before we close off for the day. We've had such a great audience here on Zoom and as well as streaming over on Facebook.
So this is Deborah. I'll wrap up with some final thoughts. This environment is going to be like this for a while, and being creative about how you stay healthy physically, mentally, and emotionally is really important. So talk to your doctor about strategies, talk to your loved ones about strategies. As we think about the spectrum of stress management behaviors and ways for us to be healthier, exercise is critical. If you're able to get out there every day, walk in your neighborhood. Pelotons, exercise bikes have been remarkably popular. Something to exercise every day and connect with the people who love you. That does a lot to help manage some of our symptoms of anxiety and depression, which have become pervasive during the course of the pandemic. So remember to engage the resources before you. We can no longer just react to this pandemic as if it's something we have to sort of stay in our houses and just be sedentary. We have to behave differently in order to maintain good health through this situation.
Wonderful. Thank you so much.
Just to reiterate what she said, which is hard to top what how she phrased that, but agreed. I just stay safe, wear a mask. Can't emphasize that enough. Get a flu shot, and then live your life as best as you can. Talk to your doctor and your care team if you have questions about you. That's what we're here for. We're here to answer that and help you understand exactly what you need to do specifically for yourself.
Thank you. Stephanie?
And I will just echo everything that they said. And one of the things I would just add to that is when thinking about your needs, we talked about the power of vulnerability, and you're already in a vulnerable space, but be willing to step into that space and make sure that you see the power of your voice. We all want to hear it as your providers, as your care team. We want to know how to best help you. We want to help support you. And I'm sure it's the same for your family and community. So make sure you're using your voice so that we know how to help.
Thank you. I want to just share these final thoughts. Get your flu shot, wear your mask, practice social distancing, wash your hands, stay connected, be strategic about it. And when in doubt, head over to the Texas Oncology Foundation website, watch the videos, find out when there's another webinar, see how you can stay connected in that way, because we are a community that wants to support you. We not only want to help you survive it, we want to help you thrive in it. It's super important. Thank you all for joining us today for this webinar. Again, whether you're watching here on Zoom, whether you're watching on the stream on Facebook, or watching this as a replay, we appreciate you being here with us. And if you have any questions afterwards, be sure to send it over to us. We'll be happy to answer. Thank you.
Thanks, Tamika. Great job.
Thank you.